Good evening and welcome to another episode of iMed. And today we're going to talk about cancers related to the urinary system as well as hematuria, or known as bleeding from the urinary canal. And to do the honors, we do have Professor Neville De Pereira, Senior Consultant of Urological Surgery at the Institute of Urology, National Hospital of Sri Lanka. Good evening to you, Professor. How significant is the cancers of urinary systems? Is it quite often found here in Sri Lanka in the patients related to particular symptoms associated with the cancers?
Yes, out of the adult cancers, it lies at the position of 6th or 7th in Sri Lanka. And if you take prostate cancer, which is not directly related to hematuria or passing blood, it has become one of the commonest cancers all over the world now. But when you talk about bleeding, blood in your urine, prostate cancer doesn't come high up in the list, because as you know, prostate cancer comes from the prostate gland, the shell of the prostate gland. So it doesn't eat into the urinary system until it is at its late stages. So it is quite a, when you take the urological practice or kidney surgical practice, it is a common problem. And hematuria or blood in your urine is a very serious symptom nobody should ignore, especially adults. And it can come up in males, females and children. But when it comes to adult males and females, we have a rule to say that until proven otherwise, you have to treat all hematurias or passing blood in your urine as cancers of the genitourinary tract until proven otherwise.
What can actually cause hematuria, Professor? Other than the cancers, are there any other condition that hematuria can be a symptom?
Yes, I think hematuria can be, it is classified into painful and painless, basically, because sometimes when you pass urine, if you get pain in your lower urinary tract, you have burning sensation or irritation in the lower urinary tract, and then you pass blood with your urine, very likely to be that it is something to do with infection or inflammation. It's not a very unlikely to be cancer, but this is not a hard and fast rule. But on the other hand, if you pass urine without any pain, just red colored urine, that is a danger signal, because lot of cancers which comes up in the kidney or the bladder, those are the two main places which will produce blood, cancers which will produce blood. So those places, the blood is shed into the urine, and then when you are passing it, there is no pain at all. So that is called painless hematuria. So benign diseases, if you take, those are infections and various types of stones can give rise to bleeding, and in children especially, if there are group of diseases called nephritis. So these nephritis, some classes of nephritis, the child can pass red colored urine. So actually, if you take, the infections are quite common, and then benign causes of passing blood are much more than cancerous causes. But what is dangerous is cancerous causes, and you have to exclude them.
Well, if blood is positive, or rather the blood is visible in urine, we can call it as hematuria. But meanwhile, Professor, in a urine full report, there can be red cells. Being red cells positive in a urine full report, is it normal or abnormal? Can we call that also hematuria?
Yes, it's a good question. Really, if you look at this slide here, this is when you pass urine and if you collect it to a container. So it's a good habit in a way to have a quick glance at your urinary stream, or once you have emptied your bladder into the commode, to have a look to see what the color. So if you see that one of these colors given in these test tubes, this is the normal color in far end right hand side, the light yellow. Light yellow is the color of urine. So some people come and say, my urine is yellow, but that is the normal color. Yeah. So if you drink a lot of water, it gets diluted and it looks like water. But light yellow color turns into this type of discoloration, light pink or dark brown or
orange
color, then you have to think of passing blood in your urine, and what we call that macroscopic or visible hematuria, visible. And as you raise the question of checking it under microscope and finding some red cells, there are some norms. If you do a urine full report and if it is properly done, if the blood cell count is more than 3 in a male and more than 5 in a female, that is taken as abnormal. So you need investigation to find out whether there is a cause. So low number of blood cells, 1 or 2, can be there in normal people, but anything more than 3 we are supposed to investigate and exclude, especially in adults, exclude cancer.
And we saw some other colors, darker colors as well in the test tubes. What can cause those kind of urine?
Yes, darker color means that the bleeding has been there for some time. So sometimes cancer can bleed into the kidney tubes and a clot can form. The clot, when it becomes older, it can get dissolved in urine and come out as this crimson color or color of some of the drinks. You know, I won't mention the names, but that shows that bleeding has been there for some time. But occasionally, some drugs also can cause this, can give rise to this color. Especially there are some anti-TB drugs given for tuberculosis. Those drugs will give rise to this color. And important thing I have to mention is that beetroot. A lot of people think that when they eat a lot of beetroot, they can get this red color. That is true, because in the Western countries, they take lots of beetroots in their salads, and you can get this red color, which is called beetroot urea. But important message here in this part of the world is that we don't eat that much of beetroot to give rise to this color. So if you pass reddish urine and you have eaten beetroot previous day or previous meals, don't attribute that to beetroot. So straight away go to a doctor and start getting investigated.
So doctor, now hematuria, or rather having blood cells or passing blood with the urine, can it have any underlying diseases other than cancer? Can it be due to a calculi or a urinary stone, or can there be other reasons for this?
Quite true, yes. We have sometimes large stones in the kidneys called staghorn calculi. They are very silent and they grow to a very large size without any symptoms, but the only symptom may be you are having red blood cells in your urine, or sometimes occasionally you pass red colored urine, and when you investigate you find these stones. So stone disease is a well-known cause for hematuria, but till you exclude cancer, we should not attribute red colored urine to stones.
Does it vary according to the sex?
Actually, the color wise, it depends on the disease rather than the sex. So
is it common in females other than the males when it comes to hematuria or the cancers? Is there a difference like that?
Yeah, all the cancers are common in males. Unfortunate thing to say, but worldwide, kidney cancers, bladder cancers, those are the two main cancers which will give rise to hematuria, and both are common in males. That's kind of a genetic predisposition, plus the main reason is smoking. Smoking has a very strong connection with the kidney cancers plus the bladder cancers. And the other predisposing factors like obesity, pathological obesity, can lead to the kidney cancers, and also hypertension. If the pressure is not under control for a long period, hypertension is also a risk factor for kidney cancers. When it comes to bladder cancers, it's different. And again, smoking is high up in the cards. And the other things are that various industrial toxins. If you have worked in industries like printing and dye, the textile industry, those chemicals can get excreted through urine and get collected in the bladder and can lead to bladder cancers.
And Professor, meanwhile, are children prone to get hematuria? Or we'll talk about cancers as well, but meanwhile, passing blood in urine, can children get this condition?
They do. They common type of glomerulonephritis, what we call glomerulonephritis, or various germs can attack the kidney either directly or indirectly, and that group of diseases are called nephritis. And these nephritis can change the kidney structure, microscopic structure, and allow blood to pass through the kidney tubes, because generally blood doesn't get filtered. Though blood goes to the kidney, only urine part is getting filtered and the blood goes back to the circulation. But in these nephritis, diseases like nephritis, blood cells can get filtered with protein, and you can have blood and protein in children.
And meanwhile, Professor, we have heard of, and even Professor did speak of kidney cancers. What other types of cancers that can be present in the urinary system? Bladder cancer, we've also heard of. What are the other common cancer types? And can you please brief us on?
Yes, basically, I think we are worried about 3 cancers which can give rise to hematuria, that is kidney, and the ureteric cancers, which is difficult to pick up. That's a problem until late stages. And the bladder cancer is the most important one to pick up at early stage, because the good news is that all these cancers are curable. If you pick it up at an early stage, you can cure it and call it a cure. So unlike good old days, where the investigations were not there, they came very late. Cancer has spread to all the organs, and then the lifespan is only 1 or 2 years. But now if you pick up it at the right time, you can actually cure them. There are various types of surgeries followed by chemotherapy and radiotherapy. And the other 2 relatively rare cancers in the tract are the testicular cancers and penile cancers, in the cancer of the penis in males. But those are relatively rare.
Why we are talking about hematuria, which is passing urine in blood, and cancers, urinary cancers, is because these 2 are interrelated. Hematuria can be a symptom of cancers as well. That's why we are talking about both these conditions together. Now, Professor, when we find hematuria, or rather blood in our urine once, when someone finds once, does that patient need to wait for another time to go to a doctor, as in like for a second time to pass blood in urine, or whether that person should consult a doctor immediately? What should he or she do?
It's a big mistake. If you wait for the second time, that may be too late. So the message is that once is enough. So if you have passed blood or red colored urine, straight away go and get it investigated, because the problem is that the cancers bleed intermittently, on and off. So first time you bleed, you ignore it, next time it may be too late. It might have spread. So don't wait for the second occasion. First time, if you have seen clear red colored urine, straight away get yourself investigated by a clinician.
So what are the investigations which are common here in Sri Lanka?
Yes, I think basically we have to prove that this is blood in urine by doing a urine full report, and sometimes, as I was mentioning earlier, it could be just discoloration from a drug or some other benign cause. So like eating, sometimes carrot can give rise to very dark colored urine, orange colored urine. So these things we have to exclude. Once we have proven that it is blood, then the first round investigations will be depicted in this slide. Ultrasound is the number 1 screening investigation. You can see here in the ultrasound scan. It's a very simple without any anesthesia or anything. It is done. It's very commonly done. Important thing is it has to be done by an experienced person, because it is very operator dependent. It depends on the experience of the person. So experienced person with a good machine also. So these 2 are the little drawbacks in ultrasound, but ultrasound can pick up most of the kidney cancers. It is good for kidney cancers. Kidneys are nicely seen. So if it is done by an experienced radiologist, they will pick up kidney cancers. But it is bad for bladder cancers. Bladder cancers, about 80% of bladder cancers are missed. Unless they are really big, they are missed. And the second investigation here, shown here, is the CT scan. CT scan has to be done with a contrast or dye given to you, injected to you, and that will pick up most of the cancers in the kidney again. Again, there is a large number of bladder cancers will be missed in that. So ultrasound and CT, good for kidney cancers, not for the bladder cancers. So ultimately, the way out is to do a cystoscopy or endoscopy, the third picture shown here. It is done under local anesthesia as a day case. We have to peep into the bladder and have a look. It is a must for anybody over the age of 40. Whatever the ultrasound or CT says, a cystoscopy is a must.
All right. Now, once this being investigated, the next stage would be treatment. So, would like to know about the treatment options available in Sri Lanka for cancers.
Yes. If you pick up a kidney cancer, the only way out at an early stage, if it has not already spread, you have come late, it generally gets spread to lungs, brain and bones. So, if there is not spread, if it is localized, it is in the kidney, you can cure it by removing it. Only treatment is surgery. For kidney cancer, radiotherapy doesn't work. It is not sensitive to radiotherapy. It is not sensitive to chemotherapy. That's the funny part of kidney cancer, there is no option. So, if you remove it altogether, the kidney plus the tumor, then you can cure it. But nowadays, we come across very small tumors, because that's a very fortunate thing, because for every abdominal pain, people do ultrasound now. So, they pick up about 40% of these cancers at a very early stage. So, if those are smaller than 4 centimeters, small stone, we can remove only the part of the kidney or only the tumor with a little part of the kidney and save the half of the kidney, and this is called partial nephrectomy. Very commonly done nowadays, still cure the patient. So, you can leave half of the kidney also. So, that is the importance of picking it up at an early stage, which is fortunately happening nowadays. And surgery itself will be either open surgery with a cut in your abdomen shown in this slide, or nowadays we do more and more laparoscopic surgery with keyholes, four keyholes there, and take the kidney out. And the highest level of that is robotics, which is yet to come to our country, and we are waiting for us to be stabilized financially to get it.
Professor, once we are investigated and the patient is diagnosed with some other condition other than the cancer with hematuria, what can be the treatment line? Like, what are the treatments that he or she can undergo?
Yes, if it's a benign disease like a stone disease, I think we have to get into the stone first of all. It may be endoscopic treatment with laser, or it may be keyhole surgery and endoscopic surgery basically, or maybe drug treatment to bring the stone out. If it's an infection, it will definitely need a course of antibiotics, and look for the cause of the infection, like poor bladder emptying or any kind of other predisposition like diabetes. So, you have to control those things and get rid of the infection. So, occasionally you hit a blank wall and find that there is no reason for blood in your urine. Those are there's a small percentage of people who after a marathon or jogging or running, they pass blood in their urine. There's nothing wrong with them. It's called jogger's hematuria. And that sort of situation, once you have excluded something nasty, you can leave them alone. And you have finished?
Yes. Well, Professor, meanwhile, we spoke about hematuria and how it can be an early sign of renal cancers. What are the other symptoms or other signs of renal carcinomas as well as other urinary cancers other than hematuria?
I think what we have to mention about the bladder cancer treatment I have mentioned here depicted in this slide.
Yes.
Bladder cancer is a dangerous cancer. If you pick it up at early stage, still you can cure it. So, bladder cancers, if it is a very early stage, we put the telescope and cut it off, and then you keep on checking it to see whether it's getting the bladder cancer again. But if you come at a late stage, still we can cure you by removing the bladder or giving radiotherapy. So, this shows that two types of treatment there, removing the bladder or giving radiotherapy. Removing the bladder is not the end of the world, because now we can, in specialized centers like we can replace the bladder, forming a new bladder with bowel. That's called a new bladder. That was to
be my next question now. What is after removing the bladder?
Exactly. Pertinent question, because once the bladder is gone, there's no way to collect urine. So, the commonly done treatment is given in this slide, the first picture, where you bring the two water tubes outside your body and fix it to a bag. But that is a lifelong cumbersome thing to do, which is called a urostomy. Like if you bring the bowel out, it's called colostomy, and if you bring ureters out and fix it to a bag, it's called urostomy here. Like and the problem is the body image get disturbed. But for that now, if you come at an early stage, we remove the bladder and we make a new bladder with the available bowel. It looks like a bladder, and then fix it to your water pipe so that you won't have any bags.
Can this patient lead a normal life after this, their day-to-day work and all?
Whole idea is that once we have given the full treatment, you have replaced the bladder or you have removed the cancer, you keep the patient under observation every 3 months for better than a year, and 6 monthly for secondly and yearly for a long period. But in between, you push the patient to become normal again.
And Professor, meanwhile, to sum it up, what will be your take-home message, especially to prevent renal cancers as well?
Yes. Most important thing is that be aware of the symptoms. So when you're passing urine, have a quick glance. It's not a bad habit. Tell the children also to have a look. And if you find any urinary symptom or red colored urine, passed once even, immediately consult your general practitioner or a specialized clinician to get investigated. And once the cancer is detected, don't be scared to undergo treatment, because most of these are curable cancers at early stages. So discuss the matter with your clinician and face the curative treatment.
Thank you very much, Professor. It was very informative indeed regarding the cancers related to the urinary system as well as passing blood in urine, which we call hematuria. And we thank Professor Neville De Pereira, Senior Consultant of Urological Surgery at Institute of Urology, National Hospital of Sri Lanka, for being with us and giving us information about these cancers as well as other conditions related to the urinary system, how to prevent them, the treatment options, and so on. Thank you once again, Professor.
Thank you.
It was a pleasure to have you on IMED. And with that, we wrap things up and we invite you to join another episode of IMED next week as well. Take care, stay safe.